Namaskara. A warm welcome back to my channel, Dr. Rajeev Pullagura. I'm a General and Laparoscopic Surgeon. Today, we are going to discuss a very common condition that I see and treat frequently, inguinal hernias. You might have heard of them or perhaps suspect you might have one or somebody you know might have one. In this video, we'll break down everything you need to know about inguinal hernias. We'll explore what are the causes of hernia, what are the telltale signs, symptoms, what to watch out for, and most importantly, what are the treatment options available, including the role of surgeon, that is both open or laparoscopic. So, what exactly is a hernia? To understand this, we need to look at the inguinal canal. This is a natural passage that is located in your groin area on both the sides of your lower abdomen. In the men, it is a route through which the spermatic cord containing blood vessels, nerves, and the vas deferens or the sperm duct passes from the abdomen to your scrotum. In women, it contains something called as a round ligament that is important in supporting the uterus. Inguinal hernia occurs when there is a weakness or a tear in the abdominal wall in the inguinal region. This weakness allows the inner lining of the abdomen, that is the peritoneum, and sometimes the abdominal contents such as pieces of your intestine or a fatty tissue called as omentum to bulge through this opening. This bulge is what you might have noticed or felt. Why do these weaknesses or tears develop? There are several contributing factors. Congenital, that is, you are born with the weakness. It might not show up during your initial years, but with time it can slowly open up, and this generally causes something called as indirect inguinal hernias, which are the most frequent type. Now, age and wear and tear. Over time, the muscles and the tissues in the abdominal wall can weaken due to aging, and this leads to increased chances of hernia. Increased pressure in the abdomen, activities or conditions that increase pressure within the abdomen can contribute to hernia development or making an existing weakness worse. This includes heavy weightlifting, chronic cough due to smoking or lung conditions like emphysema, bronchitis, asthma, straining during bowel movements or urination, obesity, pregnancy, and sometimes ascites or fluid in your abdomen. Previous surgery incisions in the groin area from previous surgeries can lead to weakening and then a hernia formation. What are the signs and symptoms of inguinal hernia? The most common sign is a noticeable bulge in your groin area. This bulge may be more prominent when you stand up, cough, or strain. It disappears generally when you lie down. Other symptoms includes pain or discomfort in the groin, especially while lifting, coughing, or straining during any activity. The pain can range from dull ache to a sharp, intense pain. Feeling of heaviness or pressure in the groin area. A dragging sensation in the groin. Occasionally pain and swelling in the scrotum. Sometimes the hernia extends downwards into the scrotum. It's important to note that sometimes, especially in the early stages, an inguinal hernia might not cause any noticeable symptoms. So, how do we diagnose an inguinal hernia? Often a physical examination is all that is needed. If your surgeon is competent, he will be able to diagnose it. During the examination, I will ask you about symptoms and physically check your groin areas, both while standing and lying down. We may even ask you to cough to see if the bulge becomes more apparent or prominent. In some cases, a diagnosis, if unclear, will require some other tests to evaluate. Imaging of an ultrasound is the simplest way to diagnose an inguinal hernia. Now, coming to treatment options. While some small asymptomatic hernia might be monitored with time, the most standard and effective treatment for a symptomatic inguinal hernia is always a surgical repair. Unlike some other conditions, hernias generally don't heal on their own. They are potential to serious complications if left untreated. Two main approaches for repairing an inguinal hernia is open surgery. This involves making an incision in the groin. Open hernia repairs, this involves making an incision in the groin area to locate and repair the hernia. Weakened area in the abdominal wall is typically closed with sutures, and often a synthetic mesh is placed on the muscles to reinforce that area and reduce the chance of failure or recurrence. Now, coming to laparoscopic hernia. This is a minimally invasive technique. Here we make several small incisions in the abdomen A thin telescope-like instrument is passed with a camera, something called as a laparoscope, inserted and visualized inside the abdomen. Specialized instruments are used to repair the hernia from inside. A large mesh is placed in this approach as well. Both open and laparoscopic repairs are effective, and the best approach for you will depend on several factors, including the size of the hernia, type, overall health, previous surgeries, surgical expertise, and your general health condition. Now, coming to what are the benefits of laparoscopic repair. Generally, it offers smaller scars, less operative pain, faster recovery, allowing you to return to normal activities sooner. However, open repair is still very valid and often preferred option in certain conditions. It is crucial to understand that potential complications of leaving an inguinal hernia untreated. They can include something called as incarceration. The trapped abdominal contents like the intestine or the omentum, that is the fat, become stuck in the hernia sac and cannot be easily pushed back. This causes significant pain and lead to bowel obstruction. Another complication is strangulation. It is a medical emergency. If the blood supply to the incarcerated tissue is cut off, it becomes strangulated, leading to tissue death or gangrene. It's an emergency requiring immediate intervention. So stop popping pills when you have hernia and you have a pain. These complications are why in most cases of symptomatic inguinal hernia, surgical repair are strongly recommended. It is safe, effective procedure that can significantly improve the quality of your life and prevent dangerous complications and situations. If you notice a bulge in your groin or experiencing any symptoms we have discussed, please don't hesitate to seek medical attention by visiting a surgeon. Early diagnosis treatment makes significant difference. We can discuss your specific condition through performing a examination and best determine the course of action for you. If you have any questions about inguinal hernias, please free to leave a comment below. I'll do my best to address them. I hope this was useful. Thank you for your time. Good day.